Okay, guys, so aspirin for the prevention of preeclampsia is so important that every GP, every medical specialist should know it, okay? So there are five things. There are five fingers on your hand. And even if one of that finger is raised, the other person is going to say, why are you pointing your finger at me? So similarly, if one of these points is present, you have to start aspirin. These 5 points are known as high risk factor, and it's high risk factors for preeclampsia. And it's common sense. If she comes to you and she is a known case of chronic hypertension, or she had a history of hypertension last pregnancy, for example, she had PIH, she had preeclampsia, eclampsia, whatever in last pregnancy. Okay, so 2 hypertension related points. Or she has type 1 or type 2 diabetes, not GDM, type 1 or type 2 diabetes. Or she is a known case of CKD, or she's a known case of any autoimmune disease, APLS or SLE, anything like that. So even if one of these 5 things in there is there, you have to start it, okay? Ideally, you have to start it between, 12 to 16 weeks, get it started, at nighttime. 75 to 150 mg, we have the dose range. Then we have the moderate risk factors. These are 6, okay? So if 2 or more are present, one you don't start aspirin. If 2 factors or more than 2 are present, then you start aspirin. For moderate risk factors, what are these? So for this, you can draw this. Okay, so she is a primary gravida, which means she was nulliparous before, and she has having large extreme of maternal age. She is elderly, more than 40 or more. Okay, this is extremely advanced maternal age. Or she is having a BMI of 35 or more. She's obese. Okay, and she's having multifetal gestation, twins or triplets, multifetal. And we have nulliparity, I've cleared it. And then family history of preeclampsia. She herself has no history in last pregnancy, hypertension, preeclampsia, nothing, but family history, maternal preeclampsia history. And then her or she is, not nulliparous, and her interpregnancy interval is of more than 10 years. So these are the 6 points, okay? Obesity, which her BMI, her age, the status of being a primary, family history of preeclampsia, large interpregnancy interval, or a multifetal gestation. So if 2 of these are present, then you're going to start aspirin. So these are the moderate risk factors, okay?